It's Dr. India with RoseMed Spa and Wellness. If you're watching this, it means you just had your Wrinkle Relaxer treatment. I want to quickly go over what to expect and how to protect your results. First, be patient. That's not my strong suit. The time that it takes to see your results depends on which product that you received. If you receive Botox, Xeomin, or Dysport, you'll typically start noticing changes in about 3 to 5 days. Full results can take about 2 weeks to fully kick in. If you receive Daxxify, that product can begin working a little sooner and sometimes within a few days, and it may last a little bit longer overall. But regardless of which brand you received, this is not instant. The medication needs time to bind to the nerve receptors and gradually relax that muscle. It's completely normal to still see movement for several days after treatment. So if you're looking in the mirror on day 3 and are still seeing wrinkles, do not panic. Trust the timeline. Now let's talk about aftercare. For the first 4 hours, we tell people to stay upright and avoid laying flat. Don't rub, massage, or even apply heavy pressure like a hat to the treated areas. That includes facial massages, tight headbands, or aggressive skincare devices. Why do I say that? Because early pressure can theoretically move that medication to areas that we didn't intend to treat. So for the rest of today, avoid strenuous exercise, heavy sweating. Light activity is fine, but any kind of intense workout, hot yoga, saunas, anything that's going to significantly increase your circulation, get your heart rate up, should probably wait till tomorrow. Right after treatment, you may notice small raised areas at the injection sites. They look like tiny little mosquito bites. These are simply small deposits of medication under the skin, and they usually settle within an hour or two. You may also see some redness and occasionally a small bruise. If bruising does happen, it usually resolves by itself within about 5 to 7 days. So let's talk briefly about red light therapy because patients have been asking about this a lot lately. There is currently no strong evidence that red light therapy breaks down neurotoxin once it's been injected. However, because the medication is still binding to the nerve receptor during those first few hours, I do recommend avoiding red light therapy directly over the treated area for 24 hours or so. There's not a ton of data on it, but just kind of something to say to be safe. After that, it really shouldn't affect your results. If this is your first time receiving tox, I want you to know that as we treat you for the first time, we try really hard to match your dose as closely as possible with what your muscles need. However, everyone's anatomy is different, and we try to not over-treat you and to save you money. So as we get to know your muscle strength and how your body responds to the medication, we do sometimes need to fine-tune the dose. That's why we evaluate your movement around the 2-week mark. If a small touch-up is needed, we can absolutely do that. Because we only charge for the exact units we use, there might be an additional charge if additional units are required. But the good news is, once we learn your anatomy and find your ideal dose, future treatments are usually very predictable. Most patients don't require touch-ups moving forward unless they have complex anatomy or it's particularly strong, or we'll kind of talk to you about it. Finally, Wrinkle Relaxer is not just about the lines. By softening the heavy muscle pull, it allows light to reflect more evenly off the skin. So patients often tell me that their skin looks brighter, smoother, less tired, even without makeup. It's temporary and adjustable, and when done thoughtfully, it should still look like you, just refreshed. So I want to say from the bottom of my heart, thank you for trusting us with your face and your healthcare. If you ever have any questions, don't hesitate to reach out. We are always happy to help.